Next question. Do you have any advice in treatment on a Morton's neuroma? The way I look at this is we weren't born with Morton's neuromas. I look at it as a plantar overload, so forefoot overload issue. And to me, therapy is absolutely key, okay? I operate on very few Morton's neuromas. I don't like it because actually it causes a lot of pain, it's difficult to recover from. So essentially, it's the posterior chain, or what I call the posterior chain. So I think we've got tight glutes, we've got tight hamstrings, tight calves, and we're pushing our feet all the way into the ground. Most of us, like I am now, are sitting down, desk-based job, commuting, we're all seated, we're all crouching down, so we're overloading that forefoot. So my advice to patients in the first instance, lots of stretching, okay, lots of therapy. Get everything mobile around the back. Number two, a dome orthotic. So again, it goes back to the orthotics. These are great. These offload and spread the metatarsals if placed correctly. There's some great videos on YouTube. I'm sure Giles will be able to put one together as well. And it just helps you with placement with this. So I avoid surgery at all costs. What do I do from my perspective? If I've got a big Morton's neuroma, I get an MRI scan. I prefer an MRI scan to an ultrasound scan. It helps me size it, helps me see it, helps me then show it to the patient, explain exactly where it is. So they've got the buy-in as well. They understand. Patient education, crucial, absolutely crucial. And then if need be, I'll try an injection. I don't do it myself. I send it to a colleague who's a radiologist who will then inject under ultrasound guidance, local anesthetic and steroid. If this takes down some of the inflammation, perfect, okay? Everyone's happy with an injection with little effect, stretching exercise in a dome orthotic. If it's refractory and it's failed all the above, then with the correct counselling, I'll consider surgery. But honestly, I try and avoid it. When they have surgery, again, back to therapy, masses of deep tissue massage. It's quite a thick bit of tissue that develops as the scar heals up. It's crucial to get that early stretching motion and deep tissue massage once the wound is healed. Hopefully that's helpful for Morton's.